You might have heard about cystic fibrosis, but did you know that cystic fibrosis increases the risk of subfertility or infertility? I'll explain how. By way of an overview, cystic fibrosis is a genetic condition in which there is a problem or a fault in a gene called the CFTR, the cystic fibrosis transmembrane conductance regulator gene. What this gene does is that it is responsible for the function of a membrane protein that helps to coordinate or regulate how salt is secreted into our body fluids. And people with cystic fibrosis will usually have problems with excessively thickened body secretions or body fluids like saliva, sweat, pancreatic juice, digestive juices, and some other fluids in the body, in the reproductive duct as well. So how does cystic fibrosis cause fertility problems? In females or in ladies or in women, cystic fibrosis will usually cause a delay in the attainment of puberty. So usually cause delay in the age at which puberty would be attained in a lady. Cystic fibrosis can also cause an excessively thickened cervical mucus. So the mucus plug, that's mucus that covers the cervix, that usually gets thin when the woman is ovulating. Usually that cervical mucus will be very thick, and even after deposition of semen, the sperm cells will not be able to swim beyond the vagina into the womb. So these are ways that cystic fibrosis can cause fertility problems in women. In men, cystic fibrosis tends to be more serious in terms of fertility. So there's something called the vas deferens or the ductus deferens, which is a tube that carries sperm cells from the testis, out from the epididymis to the ejaculatory ducts, through which the sperm cells and semen can then go into the penis and then it can be ejaculated. Now, in cystic fibrosis, there can be what we call a congenital bilateral absence of that vas deferens or ductus deferens, which means on both sides, because there are usually a pair of testicles, two testicles, on both sides, that vas deferens or ductus deferens would or could be absent. What it means is that even though healthy sperm cells are usually produced by the testicles and stored in the epididymis, because that ductus deferens, those ducts or pipes that are supposed to carry the sperm cells out, are absent. It means that even when the person ejaculates semen, the semen will usually contain no sperm cells. It can be on both sides, it can happen on one side, but usually in cystic fibrosis, it happens on both sides, which means bilateral. So those ducts are absent. Cystic fibrosis, because it causes excessively thickened fluids, can also cause the semen to be excessively thickened. So there's a difference between sperm cells and semen. Sperm cells are the sperms that swim, that look like tadpoles, whereas the semen is the fluid or the river. Imagine it like fish and river. The sperm cells are the fish, whereas the semen is the river or the water body. So the semen could be excessively thickened and can also cause blockage of other tubes in the prostate, in the seminal vesicles. These are other glands in the male reproductive organ that produce semen. So these are the ways that cystic fibrosis, this genetic condition, can cause infertility. So it can cause fertility problems in both men and women, but usually it's seen that the fertility problem in men is usually more drastic. So just a little more information on the fertility problems in men, having understood how it affects fertility in men. What will usually be done is what we call assisted sperm extractions. So because those ducts are absent, usually the surgeons will not try to go and implant new ducts. What they will rather do to help with the fertility problem is they'll extract sperm cells, usually healthy sperm cells, from either the testicles or the epididymis. The epididymis are coils of tube that lie next to the testicles, where sperm cells wait and mature before they are ejaculated. So they usually extract healthy sperm cells from either the testicles or the epididymis, and then use those sperm cells to fertilize the egg, usually in a laboratory, what we call in vitro fertilization. And then, the healthy zygote or baby that has been formed is then transferred back into the woman's body as a healthy pregnancy. So these are things that are usually done to help people who have cystic fibrosis and are struggling with fertility. So it's something to be important to bear in mind. If you know anyone who's having fertility struggles, share this video with them. It will be very important that they get checked to make sure that they don't have cystic fibrosis. Usually if they have cystic fibrosis, they would have known much earlier from having troubles with their sweats, usually prone to chest infections, sinus infections. They might have troubles with their digestion, bloating, constipation, diarrhea. So usually people with cystic fibrosis would have known much earlier. But apart from cystic fibrosis, there are other causes of fertility problems. So it's still worth sharing this video with anyone who might be struggling to conceive, so they know exactly what to do and they should be seeking help with their medical doctor. Thank you.